Welcome to Medic Talk, everyone. Today, we'll be doing a deep dive into asthma.
Oh, asthma's a good one.
It is.
Yeah.
And it's something that affects millions all over the world.
Yeah.
So whether you are hitting the books or, gearing up for clinicals, I think understanding asthma is really crucial.
It is.
So today, we'll be breaking down, all the complexities of asthma,
Yeah.
giving you clear explanations. And, of course, we got to have some handy mnemonics.
Of course. Gotta have the mnemonics.
It's a long way.
Yeah, it's more common than people might think. It affects about 25 million Americans.
Wow, that many.
That's right. And sometimes people think of asthma as just, a bit of trouble breathing.
Right.
But it's actually a chronic respiratory disease, meaning it's ongoing.
Right.
And requires long-term management.
Okay, so let's get into the nitty-gritty of it all. What is asthma?
So think of it this way. Your airways, which are the passages that carry air in and out of your lungs, become inflamed and narrow, making breathing a challenge. So it's almost like trying to drink a thick milkshake through a tiny straw.
Ooh, that's a good analogy.
It's a struggle, right?
Yeah.
You might also hear it called bronchial asthma, which refers to the bronchi, the main air passages in the lungs.
So it's not just about the lungs themselves,
Yes.
but specifically those airways getting constricted.
Exactly. And there are three main things happening in the airways that cause those breathing problems.
Okay, so this is where it gets really interesting. Hit me with those three troublemakers.
All right, so first up, we have airway blockage.
So,
The muscle bands around the airways, they tighten like a clenched fist, making it hard for air to pass through.
gotcha.
Then there's inflammation.
Okay.
This is your body's natural response to irritation, but in asthma, it causes the airways to swell up and get even narrower.
Okay.
And finally, we have airway hyperresponsiveness, meaning your airways are super sensitive and easily triggered by things like dust, pollen, smoke, even cold air.
So it's like a triple whammy, blockage, inflammation, and then just touchy, sensitive airways.
Exactly.
And no wonder breathing becomes a challenge.
Exactly. And these three factors lead to the classic asthma symptoms that we'll talk about in a bit. But for now, just picture those airways really struggling to do their job.
Okay, I've got that image in my head. Now let's talk about how asthma actually shows up. What are the signs that someone might be struggling with this condition?
Well, the symptoms can be quite varied, and not everyone experiences them in the same way. But there are some telltale signs to watch out for. Wheezing, that whistling sound when someone breathes, is a classic indicator. And then there's coughing, which often gets worse at night or first thing in the morning.
Yeah, I've definitely heard that coughing at night can be a big clue.
It certainly can. And then there's shortness of breath and that feeling of tightness in the chest, like someone's sitting on your chest. It's like you can't quite catch your breath no matter how hard you try.
It sounds so uncomfortable.
It is. And another thing to remember is that these symptoms can be mild one moment and severe the next. It's not always predictable.
So someone might be fine 1 minute and then really struggling to breathe the next.
Precisely. And some people might only experience asthma during exercise or when they have a cold, making it even trickier to diagnose.
Wow. So it's not always obvious and straightforward.
Yeah.
That must make things difficult for both patients and doctors.
It certainly does. And that brings us to another important topic, asthma attacks.
Asthma attacks, yeah, that sounds scary. What exactly happens during an attack?
An asthma attack is basically an intensification of all those airway troubles we talked about.
Okay.
The muscle bands around the airways clamp down even more.
Okay.
The lining swells up even more.
Ah.
And extra thick mucus clogs things up further.
Right.
This leads to serious breathing difficulties, intense wheezing, and a persistent cough. You might also see rapid breathing, chest tightness, and retractions where the skin around the ribs pulls in because the person is working so hard to breathe.
Yeah. It sounds pretty terrifying.
It can be, especially if it's not treated promptly. That's why it's crucial to act fast during an attack because things can escalate quickly and even become life-threatening.
So knowing how to recognize the signs of an attack
Yes.
and respond appropriately is essential.
Absolutely. We'll talk more about managing asthma attacks later, but for now, just remember it's a serious situation that requires immediate attention.
Okay, got it.
Yeah.
Now let's talk about how doctors actually diagnose asthma. What tests and procedures are involved?
Diagnosing asthma is a bit like detective work.
Right.
It involves piecing together clues from the patient's medical history, physical exam, and various tests. So the first step is usually a detailed discussion about the patient's symptoms. when they occur, what seems to trigger them.
So a lot of it relies on what the patient reports.
Yes, patient history is incredibly important.
Okay.
But we also need objective measures to confirm the diagnosis, and that's where lung function tests come in.
Okay.
One of the most common tests is spirometry, which measures how much air you can exhale and how quickly you can do it.
Okay.
This helps us assess airflow obstruction
Right.
and how well your lungs are working.
So it's a way to actually quantify those breathing difficulties that the patient's describing.
Exactly. And another useful test is the peak flow test, which measures how forcefully you can exhale.
Okay.
This can be done at home using a peak flow meter, which is a handheld device that allows patients to monitor their lung function over time.
So they can track their symptoms and see if there are any patterns.
Exactly. And in some cases, doctors might also use a methacholine challenge,
Okay.
where you inhale a substance that can trigger asthma symptoms.
Okay.
This helps us see how your airways react and can be helpful in diagnosing asthma in people who have normal spirometry results.
So it's like a provocation test
Yes.
to see how sensitive those airways are.
Precisely. And depending on the individual case, doctors might also order other tests, like chest x-rays, allergy tests, or even blood tests,
Right.
to rule out other conditions
Right.
and get a complete picture of the patient's health.
Wow. So there's a whole arsenal of tools at our disposal
Yeah.
to make an accurate diagnosis. It's amazing how much we can learn from these tests.
It is. And having a precise diagnosis is crucial for developing an effective treatment plan, which is what we'll explore in the next part of our deep dive.
This is getting really interesting. I can't wait to learn more about the different types of asthma and how they're treated. But for now, I think we've covered a lot of ground in understanding the basics of this condition.
We've talked about what asthma is, those 3 key factors that contribute to airway problems,
Right.
the common symptoms to look out for, and the diagnostic tests
Right.
used to confirm the diagnosis.
Fantastic. So for all our Medic Talk listeners out there, make sure you've got those basics down pat, because we'll be building on this knowledge in the next part of our asthma deep dive. Stay tuned.
Welcome back to Medic Talk. In the previous segment, we talked about diagnosing asthma. Now let's shift gears and dive into the different types of asthma, because it's not a one-size-fits-all condition.
Right. I remember from my studies that there are various subtypes, each with its own triggers and characteristics. It getting pretty confusing.
It definitely can. So to make it easier, let's imagine asthma types as a spectrum.
Okay. I like where this is going.
So on one end, we have allergic asthma.
Okay.
This one's triggered by allergens, those pesky substances that cause your immune system to overreact. Think pollen, dust mites, pet dander, mold, even certain foods.
Oh,
Like
no.
your body's defense system goes into overdrive when it encounters these triggers, leading to airway inflammation and constriction.
So it's all about the immune system going haywire.
Exactly. Then on the other end of the spectrum, we have non-allergic asthma. This type isn't triggered by allergens, but rather by other irritants, like smoke, strong odors, cold air pollution, even emotional stress. It's like your airways are just super sensitive and easily irritated by these non-specific triggers.
So in allergic asthma, it's a targeted immune response, whereas in non-allergic asthma, it's more of a general sensitivity.
That's a great way to put it. And then we have some interesting types in between, like exercise-induced asthma,
Right.
where symptoms flare up during physical activity.
Yeah.
It's often triggered by breathing in dry air, which can cause the airways to narrow.
I've always wondered about that one.
Mm.
Why would exercise specifically cause breathing problems?
Well, it's not entirely clear,
Right.
but it seems like the rapid breathing during exercise can lead to water loss from the airways, making them more irritable and prone to constriction.
Interesting. So it's not just about being out of shape.
Definitely not. And then there's occupational asthma, triggered by substances encountered in the workplace. Think chemical fumes, wood dust, grain dust, even things like latex gloves.
So the workplace itself can be a source of asthma triggers.
Absolutely. And identifying these occupational triggers is crucial, because simply removing the person from that offending environment can significantly improve their symptoms.
Makes sense. What about nocturnal asthma? I find that one particularly intriguing. Why would asthma symptoms worsen at night?
Well, it seems like a combination of factors is at play. Hormone levels tend to dip at night, which can increase airway inflammation. And then there's the fact that we're lying down, which can promote mucus buildup and make it harder to clear the airways.
So it's like all those asthma-inducing factors get amplified at night.
Exactly. And this can obviously lead to sleep disruptions and impact quality of life.
Yeah, definitely. And those are just a few of the many asthma subtypes we encounter in clinical practice.
Yeah.
It's fascinating how diverse this condition can be.
It really is. And this diversity highlights the importance of a thorough evaluation to determine the specific type of asthma a patient has,
Right.
because that'll guide our treatment decisions.
Okay, speaking of treatment, let's dive into that now. What are the main approaches to managing asthma?
The good news is that we have a wide range of treatment options available,
Okay,
from quick relief medications to long-term control strategies.
it's reassuring to hear. So where do we typically start?
Well, the cornerstone of asthma management is avoiding triggers.
Okay,
We've already talked about the importance of identifying those personal triggers, whether they're allergens, irritants, or even specific activities.
right.
So step one is to minimize exposure to those triggers as much as possible.
So it's all about prevention.
Exactly. But of course, avoidance isn't always feasible or sufficient,
Right.
and that's where medications come in.
Okay, let's talk meds. What are the go-to drugs for asthma?
For quick relief of symptoms during an asthma attack, short-acting beta agonists are the gold standard. These medications work by relaxing the muscles around the airways,
Okay.
providing almost instant relief.
Ah, yes, those are the rescue inhalers that everyone's familiar with.
Exactly. They're like a lifesaver during an attack.
Right.
But it's important to remember that they only provide temporary relief.
Okay.
They don't address the underlying inflammation that drives asthma.
Got it. So for long-term control, we need something different.
Precisely.
Huh.
And that's where inhaled corticosteroids come in.
Yeah.
They're the most effective medications for reducing airway inflammation and preventing asthma symptoms from developing in the first place.
So they're like the maintenance crew,
Yeah.
keeping those airways in good shape.
That's a great analogy. And they're typically taken on a daily basis, even
Yeah.
when symptoms are well controlled.
Right.
It's about keeping that inflammation at bay.
Makes sense.
Yeah.
And beyond those two mainstays, are there other medications that might be used?
Absolutely. For patients with more persistent asthma, we might add long-acting beta agonists, which
Mhm.
provide longer-lasting bronchodilation,
Okay.
or leukotriene modifiers, which block inflammatory chemicals called leukotrienes.
Wow, so it's like a whole toolbox of medications, each targeting a different aspect of asthma.
Exactly. And the choice of medication or combination of medications will depend on the individual patient,
Right.
their specific type of asthma, and the severity of their symptoms.
So it's all about personalized treatment.
Precisely. And it's important to emphasize that medication adherence is crucial for effective asthma management.
Right.
Patients need to take their medications as prescribed, even when they're feeling well,
Yes.
to keep their asthma under control.
Right. It's not just about treating symptoms when they arise,
Right.
but about preventing them from happening in the first place.
Exactly. And that brings us to another important aspect of asthma management: creating an asthma action plan.
An action plan. Tell me more about that.
An asthma action plan is a personalized written document
Okay.
that outlines what to do in different situations.
Gotcha.
For example, it might specify which medications to take when symptoms worsen, how to monitor peak flow readings, and when to seek emergency medical attention.
So it's like a roadmap for navigating asthma.
That's a great way to think about it. It empowers patients to take control of their condition
Yeah.
and make informed decisions
Mm-hmm.
based on their individual needs.
That sounds incredibly helpful, especially for patients who feel overwhelmed or unsure about how to manage their asthma.
It definitely is, and it's something that every patient with asthma should have.
Okay.
It's a collaborative effort between the patient and their healthcare provider
Right.
to ensure that the plan is tailored to their specific circumstances.
So it's not a one-size-fits-all document.
Absolutely not. It needs to be individualized and regularly reviewed
Okay.
to ensure that it's still meeting the patient's needs.
This is all really valuable information, but I want to shift gears a bit and talk about something that I think is often overlooked:
Okay.
the emotional impact of living with asthma.
That's an important point. Asthma can be a challenging condition to live with, both
Yeah.
physically and emotionally.
Exactly. It can affect sleep, work, school, relationships, overall quality of life. It's not just about the physical symptoms.
Right. And patients might experience feelings of anxiety, fear, frustration, even embarrassment about their condition.
Absolutely. I've seen patients who are hesitant to exercise or engage in social activities
Yeah.
because they're afraid of triggering an asthma attack.
That's understandable, and it's why addressing the emotional aspects of asthma is so crucial.
Right.
We need to provide patients with the support and resources they need to cope with these challenges.
So it's not just about managing the physical symptoms, but also about supporting the whole person.
Exactly. And that might involve connecting patients with support groups, therapists, or even just encouraging open communication with loved ones.
Yeah. It's about creating a supportive environment where patients feel comfortable talking about their experiences
Yes.
and seeking help when needed.
Absolutely. And we as healthcare providers need to be attuned to these emotional needs
Right.
and offer compassionate care.
Well said. Now, before we move on to the next segment, I want to touch on one more important topic.
Okay.
The potential complications of uncontrolled asthma.
This is a critical aspect of asthma management because uncontrolled asthma can have serious consequences.
All right. It's not something to be taken lightly.
Hmm.
So what are some of the potential complications?
Well, uncontrolled asthma can lead to frequent exacerbations,
Okay.
which are basically flare-ups of symptoms that require medical attention.
Gotcha.
These exacerbations can disrupt daily life, lead to missed work or school, and even require hospitalization in severe cases.
So it's not just about the inconvenience of symptoms,
Right.
but about the potential for serious health consequences.
Exactly. And over time, repeated exacerbations can actually damage the airways,
Oh, wow.
leading to a decline in lung function.
That's concerning.
It is. And in the most severe cases, uncontrolled asthma can even be fatal.
Wow. So the stakes are high when it comes to managing this condition.
They certainly are. That's why we emphasize the importance of early diagnosis, proper treatment, and ongoing monitoring to prevent these complications.
Absolutely. Well, this has been a fascinating, informative discussion about managing asthma.
Yeah.
We've covered a lot of ground, from the various treatment options to the importance of addressing the emotional and social aspects of the condition.
We have. And in the next segment, we'll delve into some of the latest advancements in asthma research and explore what the future holds for managing this complex condition.
I can't wait to hear about that.
Yeah.
But for now, let's recap the key takeaways from this segment.
All right. We talked about the importance of avoiding triggers, understanding the different types of medications used to manage asthma, creating an asthma action plan, addressing the emotional impact of living with the condition, and recognizing the potential complications of uncontrolled asthma.
Fantastic. So for all our Medic Talk listeners out there, make sure you've absorbed those pearls of wisdom, because we'll be building on this knowledge in the next part of our asthma deep dive. Stay tuned. Welcome back to Medic Talk. We've journeyed through the complexities of asthma, explored, its diagnosis, management, and even talked about the emotional impact of living with this condition.
It's a lot to cover.
It is. But now for this final segment, let's step into the exciting realm of research and innovation.
Oh, my favorite.
I know, right? So where is asthma treatment headed in the future?
Well, what's fascinating is this whole rise of personalized medicine.
Oh, yeah.
Imagine tailoring treatment to each individual's unique genetic makeup and environmental factors.
That sounds incredibly precise and futuristic.
It is.
How does that actually work?
So think of it like this. We're moving away from that one-size-fits-all approach.
Okay.
And recognizing that not everyone responds to medications in the same way. So through advancements in genetic testing and biomarker analysis, we're getting better at predicting who will benefit from which treatment.
So it's like creating a custom-made treatment plan based on your own individual blueprint.
Exactly. And this is where the field of pharmacogenetics comes in. Understanding how genes influence drug response.
Right.
Imagine prescribing asthma medications not just based on symptoms, but also on a person's genetic profile.
Wow.
That'd be pretty cool.
That would revolutionize how we approach asthma treatment.
Yes.
Minimizing that trial and error and just maximizing effectiveness.
Precisely. And it's not just about genetics.
Right.
Environmental factors play a huge role in asthma, too. Researchers are digging deeper into those specific pollutants, allergens, and triggers that actually contribute to the disease.
Right.
And this knowledge can then inform public health interventions.
Right.
Like cleaner air and healthier homes.
Absolutely. It's like taking that holistic approach, recognizing that our health is really interconnected with the health of our environment.
Absolutely. And speaking of holistic approaches, there's also a growing emphasis on integrated care for asthma patients.
Yes.
This involves addressing not just the physical symptoms, but also the psychological and social aspects of living with a chronic condition.
Makes so much sense, because asthma can be a real burden,
It can.
Patients need support on multiple levels.
Absolutely. And We're seeing more and more healthcare teams
Mhm.
incorporating psychologists, social workers, and other specialists
Yeah.
to provide that comprehensive care.
Right. It's all about empowering patients
Yeah.
to live those full and active lives despite their condition.
Precisely. And let's not forget about the exciting developments in drug therapy.
Oh, yes. Tell me about some of those new medications on the horizon.
We're seeing a surge in research on biologics,
Well,
which are targeted therapies
hmm
that block specific inflammatory pathways involved in asthma.
Wow.
They're showing great promise for patients with severe asthma
Yeah.
who don't respond well to traditional treatments.
So instead of just suppressing symptoms,
Right.
biologics are really tackling those underlying mechanisms.
Exactly. And there's also promising research on immunotherapy,
Right.
which aims to retrain the immune system
Interesting.
to stop overreacting to allergens.
Yeah.
Think of it like allergy shots,
Okay.
but potentially more effective and longer lasting.
Wow, that sounds like a game changer, especially for those with allergic asthma.
It could be.
Yeah.
And finally, let's talk about technology's impact
Yes.
on asthma management.
Oh, I've heard about smart inhalers and mobile apps that can help track symptoms and medication use.
Exactly. These digital tools are becoming increasingly sophisticated, empowering patients to monitor their condition and manage their treatment more
Yeah.
effectively.
It's like having a personalized asthma coach
Yeah,
right in your pocket.
that's a great analogy. And the potential for these technologies to improve adherence, reduce exacerbations, and ultimately improve quality of life is immense.
Well, it's truly inspiring to see how research and innovation
Yeah.
are really paving the way for a brighter future for individuals living with asthma.
It is. Asthma remains a significant public health challenge,
Yes.
but the ongoing advancements in treatment and our growing understanding of the disease offer hope for more effective management, improved quality of life,
Right.
and a world where asthma no longer limits potential.
Absolutely. And on that note of optimism, we wrap up our deep dive into the world of asthma.
It's been quite a journey, filled with insights.
It has.
We covered everything from the basics of this condition to the cutting-edge advancements shaping its future.
We explored its types, triggers, diagnostic tools, management strategies. We even delved into the emotional and social impact of living with asthma.
It's a holistic look.
It is. But most importantly, we've emphasized the importance of personalized care, patient empowerment, and holistic approach to managing this complex condition.
Couldn't have said it better myself.
Well, for all our Medic Talk listeners out there, we hope this deep dive has armed you with valuable knowledge, whether you're a student hitting the books or an aspiring healthcare professional gearing up for clinicals.
You got this.
Keep exploring, keep questioning, and keep that passion for medicine burning bright.
Absolutely.
Until next time on Medic Talk, keep those brains engaged and those hearts passionate about the incredible world of medicine.